All right, so I'll just get started. Thank you everyone for joining us today. It's so good to see you all here. My name is Gargi Mangoli. I am joining from Atlanta, Georgia. I'm the Business Development and Marketing Manager at Mendel. Dr. Mangoli has a very exciting webinar prepared for you guys. And I just wanted to go over a couple of things before we get started. So the webinar will be recorded, so you can refer to it at any time, and it will be uploaded on YouTube. So in case you miss any part of it, don't worry, we'll have it on our YouTube channel. So please feel free to like, share, and subscribe to our YouTube channel so you can stay updated. Please also make sure that you're on mute during the presentation. And if you have any questions, you can put them in the chat box for now, but we will also dedicate 15 to 20 minutes after the presentation's done. So you can interact with Dr. Mangoli as well as us. So yeah, just put them in the chat box while he's presenting, and then we'll go over questions at the end of it. Apart from that, please feel free to keep your cameras on so we can see your beautiful faces as well. And without further ado, I will pass it on to Dr. Mangoli. And thank you again for joining us.
Yeah. Thanks, Gargi, for the introduction. I would welcome all of you to Mendel Academy. My name is Dr. Kishore Managoli, and I'm the Chief Educator at Mendel. And the topic that I have chosen for today is how you can differentiate between high yield content versus low yield content in the USMLE exams. Now, this is a very common problem that students face, and while I teach, they ask me this question very often. So I thought it would be worth creating a webinar and talking about it, because it is a very important topic. It's a very important thing that you should know while preparing, because you need to focus mostly on the high yield content and not so much on the low yield content. And we'll discover during this presentation as to how you can identify them, how you can master them, and how you can remove the low yield content from your study preparation. So with that, I'm going to begin the presentation. And before we start the presentation, I would like to tell you that we are coming up with this excellent program called as the Superhit Program, where HIT stands for High Intensity Training. And it begins from May 30 through August 20. And you can register for the program on our website, mendelacademy.com. And there are very easy steps to register. And our team can assist you in the whole process of registration. There is a number through which you can access them, or you can email them, and they can walk you through the registration process. Now, what we have done with this Superhit bundle is that we have combined all the subjects related to step 1 into what we call as the Superhit bundle. And we have also created individual modules depending on some students having some areas of weaknesses in a particular subject. So it's up to you to define what you want to pick from all these options. But the Superhit bundle has a few advantages in that we have slashed the prices by 25%, and we give a huge discount of 40,000 Indian rupees. And I would recommend that you stay on the webinar till the end of this session, because I'm going to give you a very special promo code that you can use until the 15th of May and get another huge discount in addition to what we are giving already on the website. So stay here. And this is what we will be covering in the Superhit training program. And that will include more than 8,000 high yield concepts. We will be dealing with more than 10,000 high yield MCQs, which nobody does for USMLE. We have created our own proprietary Mendel sketch notes. I'm sure you will be able to see a few of them today as we go along. Then we have plenty of self-assessment tests after every subject. And the best part is there will be a performance analysis, which will tell you your weaknesses and your strengths, so that we can fine tune your weaknesses, convert them into your strengths by emphasizing a few topics, and then move forward to the next subject. I will also be conducting special quizzes on images during the Superhit, and also through some WhatsApp channel that we have already started, WhatsApp group that I have already started. I will also be conducting webinars on difficult topics and rapid review sessions. We will go through all of that again at the end of the webinar today. I would like to tell you that we have already started this Mendel USMLE Superhit WhatsApp as well as a Telegram group. We already have, I think, more than 65 participants enrolled into this, where I'm already showing you some of the important images that you can expect during your USMLE Step 1 exams. So whoever has not already enrolled, please text us or send us a WhatsApp message and I'll include you in the group. This will be a very interesting daily conversation where you can also connect with your friends. You can use it as a dashboard of sorts and interact with them at the academic level. So this will be a fun forum for all of you, and I encourage all of you to join this group if you have not already joined. So with that, let us dive into the topic that we are here for, and that is you need to know what is high yield. Basically, that is the whole problem. Sometimes everything looks high yield, not sometimes, but always everything appears to be high yield. And then we have our friends, our peers and mentors, and somebody telling you, well, you know, I got this question in the USMLE, and it comes to you at a time when you had dismissed it as a low yield concept. So we need to really know what is high yield versus low yield. Now, the problem we are facing, why do we have to differentiate high yield versus low yield, is because of the sheer information overload that we have to go through. There's so much information. These are the usual resources that are used by students, what is called as the UFAP combination, plus boards and beyond, first aid, pathoma, UWorld. And then there are additional resources which I have not put up, but irrespective of what you prefer or what you don't prefer, there is a tremendous information overload that you have to navigate through. And it becomes difficult because there are students who have told me, they have given me the feedback that everything in first aid is high yield, everything in pathoma is high yield, everything in UWorld is high yield. Now, if everything is high yield, then it is impossible to score like 250 plus, 260 plus that students are actually scoring. So there has to be a differentiation between the important stuff and the unimportant stuff. So what I have tried to do is, and what we will be doing in the Superhit program as well, is I have used these references plus so many textbooks like Harrison's, Robbins, and biochemistry, Leninger's, Harper, and so many other textbooks. Along with these USMLE resources, I have collated all that information. I have filtered out the low yield stuff, and I have come up with like more than 8,000 high yield concepts, which are asked very often from out of these resources and many more resources. And that is what you will be getting if you enroll for our Superhit program. And I have also come up with more than 10,000 MCQs, which will consolidate all your concepts. And again, I have referred to more than 20 resources. All are standard textbooks and USMLE resources, journals, publications, clinical trials and so many things. And we are going to utilize them in our Superhit program. So I would encourage you to seriously look into that after this. Now, in order to understand what is high yield and in order to understand what is low yield, let us try to define it. So high yield content is that content which most likely shows up on your exams, and that is the content that you need to master. Now, why is it called high yield? Is because it is clinically relevant. It's not just a fact, it's not just a medical fact, but it has to have some kind of clinical relevance. Then it becomes high yield. Otherwise, it is just a piece of information without any relevance. For example, if you know who invented the clinical stethoscope, that is a low yield piece of information because it doesn't help you. I mean, a patient who walks into your clinic eventually will never ask you who invented the stethoscope that is hanging on that's in your hand. So that is not clinically relevant, but the dose of insulin or some information which connects you to Alzheimer's disease is definitely relevant. And similarly, especially for step 1, high yield content also means the information that is mechanistically relevant, which means step 1 tests a lot of mechanisms of action, whether it's the mechanisms of action related to a drug, the mechanism about how an adverse event happens with a drug, or the pathophysiology of a process. They're all mechanistic processes. So high yield has to be either clinically relevant or mechanistically relevant. Otherwise, it just remains as a low yield piece of information. Now, the importance of knowing and mastering high yield obviously is that it translates into an increase in the scores. And that is what we want, isn't it? So low yield content, on the other hand, and this is where I want you to pay more attention, in fact, because what happens is everybody knows what is the definition of high yield, but they don't know so much about low yield content. It is the content which is taught in medical school. So it is not out of syllabus. Please know that it's not something which is out of syllabus. It is definitely in syllabus, but it is less likely to show up in USMLE exams specifically. Why do I say specifically? Because it may be relevant later on in your life when you get into some residency programs or fellowship programs. But right now, so far as the USMLE exam prep is concerned, it may not be so relevant because it does not add much scores to your performance. Now, we need to differentiate between high yield and low yield. So is there a guarantee that only high yield will appear and low yield will never appear in the exams? Well, the answer is there is definitely no guarantee. I have heard students tell me that low yield content has often shown up or sometimes shown up, but what we can say is the maximum number of questions that show up on the exams will belong to the high yield category. So what I am trying to convey here is that you should master the high yield content first. I am not saying that you should not read the low yield content. There will be low yield content that you will have to read up, but the priority should be in mastering the high yield category. Please don't misconstrue that as me trying to indicate that low yield is unimportant and you should ignore it. Now, the thing is, every subject that is tested on step 1 or step 2 has both high yield as well as low yield topics. So if you take pharmacology, for example, you are going to have high yield topics as well as low yield topics. Microbiology, there will be high yield bacteria, which means they are more tested compared to certain low yield mycobacteria or some types of bacteria, viruses and stuff that will not be tested. So my advice is you cannot skip any subject totally and then expect to score good marks. It is usually easy to spot high yield content, but It is very difficult to identify low yield material, which I have already told you, but I can tell you two examples of a low yield material, which is low yield come what may. It is definitely low yield because it has barely any clinical relevance. Actinobacillus, both of them are examples from out of microbiology. Then you have the cardiobacterium, which barely cause any kind of disease. So they are low yield from any perspective. Now, high yield content is important also because that will define how you will structure your study timetable. So it follows what is called as the 80-20 principle, or the Pareto principle as it is called, where you need to put 80% of your effort in mastering the 20% of high yield content. And this 20% high yield content will in turn give you 80% of your scores. So this is the beauty of mastering the high yield content first, which is why I'm emphasizing that you should look at the high yield content first. And again, to reiterate what I have said, this is what we will be focusing on during our Superhit program. And as I said, this 20% high yield content, this is almost more than 8,000 different concepts. So it's going to be very rich and very dense so far as the high yield content is concerned. Now, the questions that you will ask me and every student would like to ask is, where can I find the high yield content? How do I really know that it is high yield? And the third biggest question is, how do I actually get into action mode and master the high yield content? Are there definite strategies to do that? Is there a methodology to master it?
Behind him.
Yeah, so can somebody is not on mute.
You can mute them if you can
try. But anyway, it's okay. All right. So the first step in understanding what is high yield and what is not high yield is right there on your USMLE.org website, where if you look up, you can see the distribution of marks. Alex, I think you need to mute yourself if you can.
Yeah.
Yeah, thanks. So you can see that almost 70 to 80% of the subjects of the questions will come out of pathology and physiology. So it goes without saying that you need to master everything that is there in pathophysiology. It does all the heavyweight lifting. However, I would also like to point out that if you add up the percentages of all the subjects, they go well beyond 100%. I mean, it's just a small glance will tell you that the percentage goes up to almost 140 or 50. Now, what is the meaning of this? It means that a lot of questions that will be asked are going to be interdisciplinary, which means there will be a correlation between histology and maybe physiology. There can be a correlation between microbiology and pharmacology, biochemistry and embryology, and so on. So if you factor all the interdisciplinary content that will be converted to questions on the exam, it's going to be much more than 150%. So again, that emphasizes the point that you may look at genetics having a percentage of like 5 to 9%. So you would want to either ignore it, or you would want to say that I'll do it at the end. My suggestion and recommendation is that you don't do that. You will have to go through everything well and prepare well. However, as I said, this should be your first priority. And the same applies to step 2. I don't know if there are step 2 CK students. The heavyweight lifting is done by medicine and surgery in step 2 CK, but that again does not mean that you can ignore the remaining subjects. Now, the other resource where you can find all the high yield stuff is again present on the USMLE.org website, there is this document which is available for free download, which is called USMLE Content Online. So this content online is like around 35, 36 pages, and they have listed every possible topic that can be asked on USMLE. It's a very dense document, lots of information, lots of not lots of topics, not lots of information, lots of topics. And the importance of this document is that the question writers from the NBME, from the USMLE, make the question, they create questions from out of this document, from the topics that are listed in this document. So I know it's a very difficult task to go through all of them, but I have done that on your behalf in our Superhit program. So this is where I found those 8,000 plus topics which are called as high yield, and I have created them into our syllabus for the Superhit program. It's impossible for most students to browse through all this and master them at the individual level. So I have done that for you in the Superhit program. The second high yield stuff that you can locate would be obviously in first aid. And in particular, I would recommend that you should go through the rapid review section at the end of the book, which is around page 714 in the latest edition, that is 2022 edition. And you will get a lot of information. These are fast facts for rapid review. So this will become useful to you towards the end of your preparation, when you really want to review everything rapidly, just like a week before your exam. So this is another resource. And again, all these resources have been included in our Superhit program. Now, this is the example that I like to give. Most of these resources that we just saw, whether it is the USMLE content online, whether it was the first aid or whatever, they focus only on facts. They only list what is high yield. They don't explain anything. They don't give you the clinical correlations or the mechanistic correlations. So it's like you being provided with the raw materials. But if you want to be a super chef, you have to be able to create a good pizza. You have to be a winner. Then you have to know how to create a delicious recipe out of the raw materials. So facts versus applied knowledge is raw materials versus super chef. That was the example I was giving you. So the best way for me to explain that is through this example of thyroid hormones. Now, you would know that thyroid hormones are synthesized as diiodotyrosine plus monoiodotyrosine, making T3, and DIT plus DIT creating T4. This is very common basic knowledge that everybody would have. Now, if you go through all these high yield books that we just referred to, or sometimes even the flashcards that you might be using, this is the type of question that comes up on the flashcards or in these kind of textbooks. They will ask you what is the amino acid required for thyroid hormone synthesis. You know that it is tyrosine because it is diiodotyrosine and monoiodotyrosine from which you get T3 and T4. So this is a fact. Now, is it good enough? Well, it is easy to memorize. It is also important. It's also high yield. But it also can become a useless, low yield piece of information unless you dive deeper and apply it to understand hormone physiology. So if you want to apply it, you should know that tyrosine is non-polar, which means it is lipid soluble. So which also implies that thyroid hormones are non-polar, and therefore they can cross the lipid bilayer cell of the cell membrane. Now that is important because the receptors of most hormones are present on the cell surface. And why is that? Because hormones are water soluble most of the times. Whereas in this case, you don't need the receptors to be located on the cell surface because of their lipid solubility, where they can go right in and affect the process of transcription in the nucleus. So that will lead to hormone production faster. So this is what is tested in your exams, not this part of information about tyrosine. So the non-polarity is what you need to really master. So that deep dive is what is going to fetch you marks in the exam. The other advice that I would give you is to remember high yield information with some context. Just knowing one fact is never going to help you. The example I'm giving today is about medulloblastoma versus pilocytic astrocytoma. These are both posterior fossa tumors of the brain. You can see that this is one tumor and this is the other tumor. These are two separate patients. Now, if you see the density of this tumor, this is a medulloblastoma and this is a pilocytic astrocytoma. Now, the pilocytic astrocytoma, you can see, has two components. There is a dark area and there is a white area. The dark area is the cystic area, which is not seen in a medulloblastoma. So if they give you these kind of MRI scans, then you should be able to differentiate them on the basis of the image. Medulloblastomas are going to be homogeneously dense. So these are dense tumors. These are cystic plus dense. So pilocytic, the way I would like to remember this is pilocystic, because there is a cystic component. So there are simple ways to memorize these things. So whenever you get a picture, and the reason I'm telling you about context is that in the exams, when they want to ask you a question about medulloblastoma, then one of the wrong choices, or what we call as distractors, is definitely going to be a pilocytic astrocytoma. So it is very important that you know the difference between these two very close competitors to the correct answer. Now, as I said, do you want to ignore the low yield? The answer is no. You cannot ignore low yield, but you should first master the high yield. Now, this is one case that I would want to be representative of everything that I have told you right now. And I want you to pay full attention to this part, because it's going to really differentiate what is high yield from low yield. So we have a case, a 6 months infant, which is brought to the emergency room and displaying continued floppiness all over the body since 24 hours with a feeble, weak cry and inability to suck. The working mother who had left the baby in a child care center was informed that she was fed with an infant formula mixed with equal proportions of honey and water. The child also failed to pass stool since the onset of symptoms. The patient's condition is associated with which of the following? And we have a bunch of options. Now, all of these tell you that there is something that is going to the brain. So something that has happened which is causing floppiness, and it is related to some effect on the brain. Now, if you have been preparing for USMLE since a while, then you would know already that in an infant with floppiness and a feeble, weak cry and loss of muscle tone, it's going to be related to honey, and that honey contains spores of clostridium botulinum, and that causes the floppiness and lack of muscle tone. Now, what they have asked you is not to diagnose that this is botulinum toxin. What they have asked you is, how does it travel to the CNS? So this is where your depth and breadth of information comes in handy. You cannot just know facts. You just cannot know that honey, floppiness, and botulism. Most students stop at that point. They are important, they are high yield, but unless you connect them with the mechanistically relevant stuff, it's not going to be useful to you at all in the information. So let's, without wasting time, go to the answer. I have highlighted the important parts. 6 months, which is an infant, floppiness, honey, failed to pass stool. Again, one of the very important presenting features, constipation. The correct answer is endoneurial transport to the synapse. Now, this appears to be a very simple question in that sense. I mean, why would endoneurial transport be high yield in the first place? That itself seems to be very low yield. I mean, why are the question writers asking this type of question? So in order to understand this, let me first explain to you about the neuromuscular junction. I'm sure you know about this part, but there are certain proteins called as the snare proteins, which are responsible for fusion of these vesicles, which release the neurotransmitters, be it acetylcholine or glycine or GABA or whatever, depending on where the neuromuscular junction is located. But this clostridium botulinum destroys these snare proteins. That is the mechanism of action, which can be asked. Again, this is high yield, and they can ask you what is the target of botulinum toxin, and you should know about the snare protein. So again, this is high yield information, and that will block the transmission of acetylcholine. And if transmission of acetylcholine is blocked, you know what happens? It leads to flaccidity of muscles. Now, talking about the endoneurium, we'll come to that again, sorry. We would like to know also about the wrong options. Axonal transport to the CNS happens with rabies. The anterior horn cells of spinal cord for polio. The blood nerve barrier is targeted by diphtheria toxin. The blood-brain barrier is targeted by mercury, and herpes simplex virus is transported through the perineurium. So that brings us to the next point about the structure of the nerve itself. So this is what is high yield now. The outermost covering is the epineurium, the middle one is the perineurium, and the innermost layer is called as the endoneurium. Now, if you look only at the endoneurium, I can ask you like 10 or 12 different questions which are very high yield related to the USMLE. Now, the first one we already saw about botulinum. Similarly, tetanus toxin. Now, both are brothers because they are Clostridia, Clostridium botulinum and Clostridium tetani. Both travel through the endoneurium and then enter the cholinergic nerve endings. Similarly, diabetic neuropathy, which is not associated with this question, but these are the integration points that we will go through when you, if you decide to sign up for our Superhit module, because this is a very important concept. Diabetic neuropathy, very often, very frequently tested. You should know that the endoneurium also has small arteries, not arteries and arterioles. Now, those undergo glycosylation, and that glycosylation causes these arteries to become stiff, and that will cause the neuropathy in diabetes. The third important thing is that rabies travels through the axons of the nerves to cause the damage. We spoke about poliomyelitis, all the wrong choices that we saw in the question. Again, GBS or Guillain-Barré syndrome, as it is called, it destroys the Schwann cells. So if you look at just one nerve terminal, there are so many questions that can come out of this. And this then becomes a very high yield cluster of facts that you need to really master. And these are what I call as the integration points, which you need to really master. So, and again, we know that botulinum and tetanus, both of them destroy the snare proteins. So the next step is to understand why a topic is high yield. Now, this is a typical floppy infant that you see because of botulinum toxin. Now, honey is banned up to 1 year because the gut flora are still not developed well enough to handle the botulinum toxin. Now, why is botulinum important? Why is it high yield in the first place? Because it can be used as a bioweapon. In the US, irrespective of who is going to mentor you and what books you read, botulinum is high yield because it is a bioterror weapon. Why is it a bioterrorism weapon? Because it has no antidote, right? So because it is a bioweapon, it is high yield. And if you want to understand this, dive deep in. understand the context. As I said in the earlier example of medulloblastoma versus a pilocytic astrocytoma, nothing is high yield without that proper context. Here we have a very beautiful context, and that is tetanus toxin. Now, why is it a very close option to botulinum toxin? Is because it belongs to the same family of bacteria, which is Clostridia. It has almost the same mechanism of action, which is they both decimate the snare proteins, but tetanus is not a bioweapon because it has an antidote. So it is relatively low yield compared to botulinum toxin, but tetanus itself is high yield because it provides the question writers the perfect distractor, the perfect wrong answer that can mislead memory masters. There are students who like to just memorize stuff, and they can easily be thrown off guard by using this as a distractor. So you need to know again everything about tetanus. Now, tetanus, although has the similarities that we have seen, it has exactly the opposite effect. It causes uncontrolled muscle spasms, not flaccidity. See, this is a case of opisthotonus that you see in a real case of tetanus. There have been paintings that have been made on opisthotonus. Now, this brings us to another integration point, and that is strychnine. Strychnine has a similar mechanism of action as tetanus because it also blocks the glycine receptors just the way tetanus toxin does. So again, the problem with strychnine is it has no antidote and it can be used as a bioweapon. So if you see that how everything comes a full circle, botulinum is a bioweapon, tetanus is not a bioweapon. Both are Clostridia, but one is a bioweapon, the other one is not. The integration point is strychnine, which is a bioweapon, but it is not a Clostridium species. So you need to know the entire cluster very properly if you have to differentiate, because they will use these as the wrong answer choices in your questions. There is a third Clostridium, a cousin, a very close, which is Clostridium difficile, which belongs to the same family, but it has no effect in the first place on the neuromuscular junction. It is more close to Peptostreptococcus, which is an obscure commensal bacteria in the oral cavity, and it is the lowest among the Clostridia species that we saw. If you compare botulinum and tetanus with Clostridium difficile, then Clostridium difficile is low yield, and it is the outlier in the Clostridium family so far as the MCQs are concerned. However, it becomes very important, Clostridium difficile, if you consider some other clinical scenario like the pseudomembranous colitis. I'm sure students who have already started preparing for USMLE would know that the most important bacteria from the perspective of pseudomembranous colitis, an image that I have put up here, is Clostridium difficile. And in this context, Botox and tetanus are low yield. So that is how you should read stuff in the proper context. And here, this low yield Peptostreptococcus is a high yield distractor for C. difficile because it can cause exactly a similar picture like pseudomembranous colitis. So everything is relative, nothing is absolute. Now, as I said, most resources that you have been using, they will only end up delivering incomplete content. Incomplete content is always low yield content, irrespective of high yield, how high yield it can become if it is put in the proper clinical context. Just facts are always low yield. So in order to really convert it into high yield content, you need to dive deep and find those clinical correlations that will convert them into pearls of knowledge. Once you know that a topic...
Sorry to interrupt, just a 20-minute heads up.
Yeah, I'll take 5 more minutes. So once you know that a topic is high yield, then you have to gather depth as well as breadth of knowledge. Like for example, in this case, you should know about endoneurial spread, because that is what is tested. You should know that they attack the snare proteins. You should know that they block release of acetylcholine, leading to floppiness and flaccidity. You should also know everything about tetanus toxide, and that it blocks the inhibitory Renshaw cells and blocks the receptors of glycine and GABA and cause opisthotonus, or increased muscle tone. You should know the distractors that can be used to confuse you, like strychnine poisoning, rabies, HSV, everything that you saw in the question. The question writers, the reason why you need to do this is because the question writers are going to use these deep pockets of information to create novel MCQs from simple facts. So it's not so much about the facts. Facts they use are simple, but they use the deeper pockets of information to convert them into very good questions. And that is where very smart students also can falter, because there is a tendency of even the best students to memorize the buzzwords. And if your minds are preconditioned, then you can very easily be confused by using these deep pockets of information. So if you want to really master them, as I said, you will have to browse through multiple resources, lots of information. You have to use a clinico-pathological multi-pronged approach, which will include textbooks, journals, interdisciplinary reasoning, algorithmic thinking, integrated learning, solving high-yield MCQs, and taking self-assessment tests, which we will do at Mendel Academy through our Superhit program. So I would like to conclude by again announcing our upcoming Superhit program starting May 30 and ending August 20. It is called Superhit because it is high intensity training. Now you know the importance of high yield concepts, and you know where from I have generated these 8,000 high yield concepts, and also more than 10,000 high yield MCQs. These are not just regular simple MCQs. Remember, these are high yield MCQs. I gave you the example of the endoneurium and how we can generate more than 8 to 10 MCQs, high yield MCQs, just on the basis of one particular concept. You saw those diagrams about the endoneurium and the axon and the neuron. That is a sketch note. Those are notes that I have myself hand drawn so that I can simplify your process of learning, and also the process of retention of knowledge and recall of knowledge whenever you need it. Our program is going to consist of self-assessment tests and performance analysis, which will be like a SWOT analysis, which will tell you what are your weaknesses and strengths. Image-based quizzes, you are already seeing those on our WhatsApp groups, plus difficult topic webinars and rapid review sessions for you in the Superhit module. And this is how you will definitely amplify your success. And we have done it in the past for several hundreds of students. I think you should also take advantage of this. Now, again, about the bundle, I'm going to give you that promo code, which will give you an extra discount. As you know, we have the Superhit bundle, where we have already knocked off 40,000 Indian rupees for your benefit. This is applicable only for the bundle, not for individual subjects. The promo code that I'm going to reveal right now is also applicable only for the bundle. And that is as follows. This is the bundle that you need to note. You can take a picture, you can have a screenshot or whatever, but this promo code needs to be used when you check out. So you are going to save 40,000 here, and if you use the promo code, you are going to save another whopping 10,000 rupees. So overall, you are going to save as much as 50,000 rupees, and the amount that you will be paying me would be 1,10,000 for this Superhit bundle. So this is what you are going to do and save 50,000 if you want to enroll before May 15th. You have to enroll before May 15th if you want to get this early bird promo offer. So with that, I think we come to an end of the session. and I'm ready to take questions, if any, from all of you. I think I will go back to that slide where you can take a look at the promo code. I'll keep it on this slide. And if you already have questions, please ask me. And try to keep the questions relevant to today's presentation. All right. Kagi, do we have questions?
Not yet, but I was just going to say, feel free to put your questions in the chat so I can read them out.
Sometimes it happens that you may feel awkward to ask questions here. Then you can certainly text me, DM me separately if you have questions. But I would appreciate if you do it today, right now, because everybody else will also benefit from your questions.
And I can add an email that you can use to also send us questions if you prefer that method. So
Yeah.
it's ask@mendelacademy.com. So Alex is asking, what time do the lessons of the Superhit start?
Oh yeah, that's a good question, Alex, especially because you are based out of Italy. It's going to begin at 6 p.m. 5 p.m. Indian time, and it will end at 9 p.m. It's a 4-hour-long intense session. So I don't know what time that would be in Italy, but the other thing that I would like, I don't know what time that will be in Italy, 5 p.m. Can you tell us what time that is?
Let me look it up real quick. So that will be 1:30 p.m.
Oh yeah, I think that's not a bad time for you, Alex. The other thing that I must tell everyone is that these will be live online classes and they will be recorded. The Superhit classes will be recorded, and whoever subscribes to the Superhit bundle will have access for 1 full year. So whenever the student wants to come back and take a look, listen to some concepts that you're not strong with, then the material will be available to you on the website for 1 full year. That is 365 days from the day we start, which is going to be May 30 onwards. Yeah. Any questions yet? No questions. I think I hope you have understood the importance of knowing everything about high yield in a context, because that is something that students really miss out most of the times. And it's also important that you look at maximum number of questions. The key to getting good scores is to solve maximum questions.
So sorry. So Alex has another question. He's asking, during these live lectures, can we bring our own problems if there's time?
Well, during the lectures, it may not be possible, but I would certainly welcome questions from everybody who enrolls, because that's very important for me to understand how your prep is going on. So you will have the email ID, and we will have our WhatsApp groups, and we will have our dashboard for discussions where you can put up the questions whenever you have any, and they will be answered immediately. Or we will decide a day, maybe during the weekends, when I will answer all the questions. Yeah, I would really like to have maximum questions coming out from the students. Alex, you would be welcome to do that, but not during the 4 hours, because as it is, I'll be dealing with a lot of stuff.
So there's another question. Nagar Naveen is asking, sir, can you show me the weighted slides for step 1 and step 2 again, like subject-wise weighted slides?
You want to see the slides? I can show it here, but the better way would be to go to usmle.org. and you will get that information. Not just that, you will see many more tables with topic-wise weightage as well. For example, cardiovascular system and the musculoskeletal system. So I would encourage you to visit the usmle.org website, and you will find not just one table, but like a bunch of tables. Okay. If you guys are okay with this slide, I can take you back to that slide as well. Let's see how many slides I have to go back for that. So we write up. So who asked this question, Gagi?
Nagar Naveen. I'm sorry if I'm mispronouncing your name.
Okay. The point is he asking about step 1 or is it about step 2? CK?
He said weighted slides for step 1 and step 2. So
you have to go all the way back. Yeah. Okay. Yeah, this is it. And I would still encourage you to go and see the visit the website usmle.org. Okay. Any other questions? You can take a picture of this slide and I can go back to the last slide.
Yeah, I would just encourage everyone to also visit our website for more information on like how to sign up for other programs and offers and things like that. So
yeah, so this is an example of the sketch notes that I was talking. We have hundreds and hundreds of these images which I have created with my hand. So these will be very, very useful. I am sure there are some students who have attended my earlier webinar as well, and they have seen like a few of them already, which are different from what I'm showing today. It really helps you understand, retain, and recall very quickly. It's a very rapid review resource for everyone. Yeah. Any other questions, or are we done for the day?
we have one more question. Is there a way to access the timetable for the courses?
Yes, it's on the website. If you go to the website, you have a very detailed timetable which you can download and use. Yeah, it's on the website, mendelacademy.com.
Alex is saying good, very well prepared slides, easily beats reading notes all day.
Oh, thanks, Alex. Thanks for attending, because we have been in conversation for a while and I appreciate your patience. You have been asking me questions, which I appreciate again. Thanks for attending, because this was, I think this is an important thing that needs to be understood very well, especially those who are just beginning out with the process of preparation. I'm glad you liked the slides, Alex.
Any other questions?
We have like 3 more minutes.
We have one more question. How can we track our performance through this course?
Yeah, that's a good question, because everything will hinge on your scores, and we will be coming out with metrics which will be generated. Suppose we ask questions on physiology or pathology, you will get to know whether you're weak in physiology, whether you're good in pathology or pharmacology, microbiology. That is the macro level of knowing. And then we will also have deeper metrics, which means that it will tell you whether you are particularly weak in cardiovascular embryology or you are weak in cardiovascular pharmacology. So we will tell you, we will go with our deep analytics to help you know your real weaknesses, so that we can do the course correction. Giving you just the low yield metrics, as we can, I mean, in the context of today's presentation. Low yield metrics will only take you so far, but we have to deep dive into the metrics as well. So we will give you high yield metrics. It will be about every single topic. In fact, whatever topics that are asked in the self-assessment will be shown in the form of graphs. Even if there is I mean, suppose take today's question on botulinum. If you don't answer that properly, we will flag off and tell you that you need to read up everything about clostridia. You will have to read up about Clostridium botulinum and Clostridium tetani, as well as Clostridium difficile. So that is the depth of metrics. It has to match with the depth of the high yield topics we are covering. So they will go hand in hand. So you can do proper course corrections. That's a good question.
We have one more question. Dr. Mohammad's asking, can we pay the fees in installments?
Well, I don't know about that part, but
maybe Hari,
I think my team will get back to you. Hari, can you revert back to him, send an email to him about that part?
Yes, sir.
I think you can do that. You can pay by installments, but I'm still not sure about that part.
So generally speaking, we take that by case basis, and depending upon your case, we'll take your request to the leadership team and we'll take a final call on that. So I will get back to you, doctor.
Yeah, you can note his email ID because
yep.
That's an important question.
Thanks for the question. Anything else?
We have run out of time. Is that true?
Yeah, like a minute above.
Yeah, okay. We can take one question if it comes within a minute.
See you in May, Alex.
Yeah, okay.
All right, it looks like I think we're good. As I mentioned, I'll put our email address so you can either email us, and then I'll also put our WhatsApp number. So if you want to text us with questions, feel free to do that. And then, of course, if you have additional questions, you can go to our website. So I'll leave a link for that as well. So thanks everyone for joining. We really appreciate you taking some time out on this Saturday evening. So we look forward to seeing you in our Superhit program.
And I would also like to end by thanking everyone firstly for attending. And then I would encourage you to join the WhatsApp group if you're not already there, so that we can have some good academic discussions. So I too will hope to see many of you in the Superhit program, which will start from May 30.
All right. Have a good one.
All right. So let's end the session. Thanks everyone again.